Good morning. Today I'll be taking the class on the macroscopic aspects of the gingiva. The oral mucosa, based on function, can be classified into masticatory mucosa, specialized mucosa, and the lining mucosa. The masticatory mucosa is keratinized and it is made up of gingiva and hard palate. Both the gingiva and hard palate have similarities in thickness and keratinization of the epithelium, thickness, firmness, and density of the lamina propria, and in being immobily attached. But there are some differences in the submucosa of the gingiva and the hard palate. So, what is gingiva? It is a part of the oral mucosa that covers the alveolar process and surrounds the neck of the tooth. It extends from the dentogingival junction to the alveolar mucosa. Morphology of both the epithelium and connective tissue indicates adaptation to the forces of mastication and pressure of mastication. On the outer surface, the gingiva is limited in both jaws by the mucogingival junction. The mucogingival junction separates the gingiva from the alveolar mucosa. The alveolar mucosa it is reddish in color because of the numerous small vessels closing close to the surface. Clinically, the mucogingival junction can be seen as a junction between the bright pink alveolar mucosa and the pale pink gingiva. In the inner surface, a line of demarcation can be seen between the gingiva and the floor of the mouth. But this distinction between the gingiva and the peripheral palatal mucosa, it is not so sharp. The normal color of the gingiva is pink, but they may have a grayish tint sometimes. The color of the gingiva depends in part on the surface, whether it is keratinized or not, on the thickness, and in part on the pigmentation. The surface of the gingiva may be translucent or transparent, which permits the color of the underlying tissue to be seen. The reddish or pinkish tint of the gingiva is due to the color given to the underlying tissue by the blood vessels and the circulating blood. The gingiva can be divided into the free gingiva, attached gingiva, and the interdental papilla. So this is the picture of the attached gingiva, interdental gingiva, marginal gingiva, and the maxillary vestibule, mucogingival junction, etc. The free gingiva is the unattached portion of the gingiva that surrounds the teeth in a collar-like fashion. The free gingiva forms the soft tissue wall of the gingival sulcus. The free gingiva forms a scalloped outline on the facial and the lingual surface of the teeth. The contour of the free gingiva depends upon the shape and alignment of the teeth. Next, the free gingival groove. This is the dividing line between the free gingiva and the attached gingiva. The free gingival groove, it runs parallel to the margin of the gingiva at a distance of 0.5 to 1.5 millimeters. The free gingival groove is almost at the level of the bottom of the gingival sulcus. It is not always visible microscopically. The free gingival groove in histological sections appears as a shallow V-shaped notch. It is not so well defined in some cases. This free gingival groove and the epithelial ridge is probably caused by the impact of the functional forces on the gingiva. In the absence of the sulcus, there is no free gingiva. The gingival sulcus. It is a shallow crevice or a V-shaped space which is present all around the teeth. The sulcus is bounded by the tooth on one side and by the marginal gingiva on the other side. Depth of the sulcus varies from 0.5 to 3 mm with an average of 1.8 mm. If the depth of the sulcus is more than 3 millimeter, it is a pathological condition which is called as a gingival or periodontal pocket. So this is the sulcus depth measured by the instrument called as a periodontal probe. Here you can see some recession of the gingiva has occurred. This is the periodontal probe with its markings. If the sulcus depth is greater than 3 millimeter, it leads to a condition called as a gingival or periodontal pocket, which is a pathological condition. Now, attached gingiva. The firm, resilient, immobile portion of the gingiva that is tightly bound to the alveolar bone is called as the attached gingiva. The attached gingiva extends from the free gingival groove to the mucogingival junction. This attached gingiva is about 4 to 6 millimeters and it is 3 millimeters below the level of the crest of the alveolar bone. That is, the mucogingival junction is 3 to 5 millimeters below the level of the crest of the alveolar bone. This is your attached gingiva. As you can see, the surface over here, it is somewhat similar to that of the surface of the orange, with its elevations and depressions. Hence, the surface of the attached gingiva, it is also called as a orange peel appearance, which is marked by a surface that is irregular with elevations and depressions. This surface is also called as stippling. So these are all probably some functional adaptations of the gingiva to mechanical forces. The disappearance of stippling, as you can see in this picture, indicates the presence of an edema. That is an expression of involvement of the gingiva as in progressive gingivitis. The attached gingiva. It is characterized by the stipple surface. Portions of the epithelium appears to be elevated, and between the elevations there are some shallow depressions. The net result of such a surface is called as stippling, which is also called as the orange peel appearance. These are probably some functional adaptations to mechanical impacts. In younger females, the connective tissue of the gingiva appears more of fine texture than that of the males. But with increasing age, the connective tissue becomes more collagenous, that is, the collagenous fiber bundles becomes more porous in both sexes. And in males, they have a more heavily stippled gingiva. This stippling, it is absent in children younger than 6 years of age. In females, majority of the nuclei contains a large chromatin material adjacent to the nuclear membrane. So this is your attached gingiva. This is your free gingiva. The sulcus depth is being measured by the periodontal probe. Then the interdental grooves. Gingiva appears slightly depressed between adjacent teeth, which is corresponding to the depression on the alveolar process, which is present between the eminences of the sockets. In these depressions, the gingiva forms slight vertical folds, which is also called as the interdental grooves. So these are your interdental grooves. The interdental papilla is a part of the gingiva that fills the space between two adjacent teeth. Appearance of the surface of the interdental papilla when viewed from the oral or vestibular part aspect, it is triangular. The interdental papilla has a three-dimensional view in between the posterior teeth. It is often a tent-shaped In the posterior teeth, the oral and the vestibular corners gets high and the central part is depressed like that of a valley, whereas in anterior teeth, the interdental papilla, it is more or less pyramidal in shape. Hole. The central concave area of the interdental papilla that fits below the contact point, and this depressed part of the interdental papilla, it is called as a cone. So the cone is covered by a thin, non-keratinized epithelium, which makes it more vulnerable to periodontal disease. So this is the end. I'll be talking about the microscopic aspects of the gingiva in the next class. Thank you.